Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. In this podcast, we discuss two articles which were published recently in the New England Journal of Medicine. The first article studied intraosseous versus IV vascular access for out of hospital cardiac arrest. This trial was done in Denmark with a sample size of 1479, and the primary outcome was ROSC. The results were ROSC was achieved in 30% in the intraosseous group versus 29% in the IV group, p-value 0.49. The 30-day survival was 12% in the intraosseous group and 10% in the IV group, with a confidence interval of 0.87 to 1.56. So this first study concluded no significant difference in outcomes between intraosseous and IV access. The second study was a randomized trial of the drug route. It again compared intraosseous first versus IV first drug administration in out-of-hospital cardiac arrest. It was a UK-based trial. The sample size was larger, N of 6,082. The primary outcome was 30-day survival. The results, the 30-day survival was 4.5% in the intraosseous group versus 5.1% in the IV group. P-value was 0.74. Favorable neurological outcome, 2.7% in the intraosseous group versus 2.8% in the IV group. The ROSC, that is return of spontaneous circulation, was 36% in the intraosseous group versus 39.1% in the IV group, with the confidence interval of 0.76 to 0.97. The second New England Journal study concluded IV first had slightly higher return of spontaneous circulation, but no survival advantage. Key takeaways and clinical implications. Findings across both studies. No significant benefit of intraosseous over IVs for survival or neurological outcomes. Intraosseous is faster but does not improve survival rates. IV remains the preferred first choice. Clinical implications. Prioritize IV access when feasible. Use intraosseous as a backup. Optimize drug administration and timing and access strategies. Future research should focus on improving out-of-hospital cardiac arrest resuscitation outcomes.